In the last month, you may have seen this headline saying that in the last year, there have been 1,700 cardiac arrests or serious conditions in athletes since the COVID vaccine. Also, it went on to say in the article that in contrast to that, over the prior 40 years, there were only 1,100 deaths, or on average, about 25 deaths per year. It's a terrifying headline, and it's also blatantly false. But you don't have to just take me at my word. Let's go through their claims one by one. First, let's look at their list of 1,700 people. Now, this was not a peer-reviewed list. Anybody could submit anyone. This person was a 27-year-old who died of a self-inflicted gunshot wound. This person, a 26-year-old, had been suffering from leukemia. This one, a 64-year-old male, died of cancer. And here's another 62-year-old male who was found after a brief battle with cancer. The rest of the list is exactly like this. A whole bunch of people, many of whom we don't have any evidence that they even died of sudden cardiac arrest, and also no knowledge of the COVID vaccine, and many of them who are also not young nor athletes. So now that we've shown that that list is ludicrous, let's actually get the data. Is sudden cardiac arrest on the rise in the last 2 years? The data hasn't been fully published because it takes a while to verify death certificates and causes of death. So instead, I went to two really trusted sources that tend to be the leading experts in publishing this data. Both said that they have data coming out soon, and here is what they told me. One is the CARES database, which is a national database of all the calls for cardiac arrest, sudden cardiac arrest, and other causes of cardiac arrest across the United States. As you can see from the graph below that I made off of their data, the calls for cardiac arrest started to rise in the mid-2010s. And then we saw a really big jump in 2020 when the pandemic began. But 2021, when the vaccine was introduced and started getting widespread use, is we actually saw a more of a slowing and leveling out of the calls. I talked to their founder and he said the same is what they see for the 2022 data. They said they'll be publishing that data in the next couple of months, so we'll keep our eyes out for that. I also went to Dr. Jonathan Dresner, who is himself a sports medicine doctor, team physician for the Seattle Seahawks, and writes profusely and proficiently on this, specifically has worked with the National Center for Catastrophic Sports Injury Research. He says that he has looked at all the data from 2022 and has not, again, they have not seen any massive jump in the last year. So bottom line, this claim that there were over 1,700 young athletes having sudden cardiac arrest after the COVID vaccine was blatantly false. Now let's look at their second claim. Their second claim was that over 40 years, from 1966 to 2004, for one study, there were 1,100 deaths total of cardiac arrest, and meaning around 25 deaths per year. Is this true? No. So look at my data here. This is a table I made summarizing the data. Now this data is based on some studies from the early 2000s and mid 2010s. And we see that from ages 5 to 14, there are about 250 sudden cardiac arrests per year. And ages 15 to 24, there are around 600 to 700 sudden cardiac arrests per year in the United States alone. Now, looking at a few other sources of data, just to give a few more data points. FIFA has actually been monitoring sudden death for over 10 years in people playing soccer. And they noticed that between 2014 and 2018, there were 617 deaths from people just while playing soccer. So about 150 deaths per year just from soccer alone. Now let's look at the data from the National Center for Catastrophic Sports Injury Research. They look specifically, in this case, at sudden cardiac arrest while young people are playing sports. They said that they have had approximately 30 people reported every year with sudden cardiac arrest deaths in the United States. And they say they think they have about only 50% of the total cases reported to them. So the minimum, again, we're talking 30 deaths per year there, young people while playing sports. Now, one more data point, looking at the NCAA, which has been monitoring sudden death and sudden cardiac arrest for the past 20 years. And they said between 2004 and 2008, there were 45 deaths from sudden cardiac arrest just in NCAA players alone. So it should be clear that both of these headlines are blatantly misleading. As an ER doctor, I take care of young people when they come in with cardiac arrest, and I agree, it is terrifying. But what is most terrifying to me is how these articles are so misleading that they distract us from looking at sudden cardiac arrest and looking at the things that we can and should be doing to reduce the risk. So please, share this video, check out the full report for things that you can do to reduce the risk for yourself and your family, and let me know what questions you have. I'm Dr. Daria, and I'll talk to you soon.